Hi everybody, Dr. Ahles here. In this short video, we're going to talk about how blood typing is done and talk about the anatomical basis for each of the types of blood that the human body has. Let's start with a discussion of how we determine the letter in your blood, as well as the plus or the minus. So when we talk about the type of blood that you have, we are looking at your erythrocytes. Let's underline, highlight, star, erythrocytes. Remember, that's the red blood cell. When we talk about the types of blood that we have in humans, we use what's called the ABO blood typing system. The ABO blood typing system relies on the detection of A or B antigens. So A or B antigens, these are two kinds of glycoproteins. It's just a fancy word for a protein that has sugar attached to it. When we look at the type of blood that a person has, the letter in their blood type tells us which of these antigens, A or B, we have. So someone with type AB blood has both A antigens, shown here in yellow, and B antigens, shown here in blue. They have both A and B sugar proteins on the surface of their cells. Someone with just type A blood would only have A antigens. Someone with type B blood would only have B antigens. Notice someone with type O blood doesn't have any antigens on its surface, on their red blood cell surface. Here's a wink, wink, nudge, nudge. There is not an O antigen. So I don't have a particular type of sugar that when I look at it, I call it O. If someone has type O blood, it means they have no A's and no B's. There's no special O something to have. In addition to that ABO blood typing system, we also typically use what's called the Rh system as well. When we talk about the Rh system for blood typing, we're looking at something called the Rh factor. The Rh factor is another sugar protein, technically called the rhesus factor. If you have a positive at the end of your blood type, it means you do have the rhesus factor, the Rh factor. If you have a negative at the end of your blood type, that means you don't have the rhesus factor. Now, in real life, you're not just going to tell me if you have A blood or B or AB or O. You're going to tell me a combination of both the Rh factor and the A and B antigens. So you might have type AB blood, and either you would be AB positive or AB negative. You could have A positive, notice we have those Rh factors, or A negative. Now notice, even if I'm negative, I still have those particular sugar proteins that my letters match up with. So AB has both A and B, just no Rh factor. We see the A's on A, the B's here. Remember, when we talk about type O blood, there are no antigens, no A's and no B's on the surface of O. O negative blood, notice how there's nothing on the surface of those red blood cells. O positive, nothing except for that Rh factor. So when we're thinking about each of these types of blood, the first thing you need to make sure you know, which antigens or which sugar proteins do I find on the surface of the cells? Our options are A, B, or Rh factor. Those are the only options. When we know which type of blood you have, we can also predict which kind of antibodies you make. Antibodies are things that our immune system uses, like we talked about with the B cells, to capture things that don't belong or flag them so the body says, yeah, this is not supposed to be here. When we're thinking about which antibodies you have in your body, we need to underline, highlight, star, as you've already written it. We're only making antibodies for things we don't have. The goal of antibodies is to tell your body, this is not normal, it does not belong here. So we don't want to make antibodies for something we do have. So we're looking at our blood typing system here. In particular, this image just shows the ABO blood typing. Let's look at this picture really carefully. Type A blood has A antigens on the surface of the red blood cells. Your immune system knows that that's normal for you. You're supposed to have A proteins in the bloodstream. But what's not normal for you is having B proteins, like we see over here, B proteins in the bloodstream. Because that's not normal, your body will make antibodies that are anti-B. They go against that B sugar protein. So if I have type A blood in my plasma, in the fluid around that blood, I'm going to have antibodies that attack the B sugar. If I have B, or if I have type B blood, I'm going to have antibodies that attack the A antigen because I don't have that on the surface of my cells. Notice for a person with type AB blood, they have the A and the B antigen. Because of that, they don't make any antibodies against A or B because both of those are normal. But notice my friends over here with type O blood. Their red blood cells don't have A's, they don't have B's, so any of those kinds of things would be abnormal for them. Their antibodies in their bloodstream would be both for A and for B. Now check this out. My picture has a weakness in that we don't have the Rh system being shown here. But if you're someone with Rh negative blood, that means you don't have the rhesus factor, the Rh factor, on your red blood cells. That would mean that you would make antibodies that attacked that. If you did have the Rh factor, like we saw over here with AB, we just wouldn't make an antibody for that. So let's take a peek at this practice activity that you have. I want to highlight as we're looking at this that there's two kinds of information that you can get from a person's blood type. First, we can get an idea of the antigens or the sugar proteins that are on their red blood cells. Something we want to remember is that antigens are always on the red blood cells. They're attached there. Antibodies are the things that we make against the sugar proteins we don't have. Antibodies are not found on our red blood cells. They're found in the serum, or they're found in the plasma part of the blood. So let's look at these different kinds of blood and see if we can make a prediction about the antigens and the antibodies. The first type of blood that we see here is A positive. The letter A tells me what I have on the surface of my antigen, or of my red blood cell, excuse me. Because it's the letter A, I know that I have A antigens. When I look at the positive after it, that tells me that I also have the Rh factor. So someone with A positive blood is going to have A antigens and the Rh factor. When I look at their serum, at the antibodies they have, having A proteins is normal for them. They're not going to have antibodies for A. Having B is not normal. They're going to have those antibodies against B. And having Rh is normal for them. They're not going to have anti-Rh antibodies. Let's look at our next one. We have a patient with type B negative blood. The letter B tells me that this patient has B antigens on their red blood cells. The minus sign here tells me that they do not have the Rh factor. So when I'm looking at what antibodies they would have in their body, they're used to seeing B sugar proteins. They're not going to have those. But they're not used to seeing A sugar proteins or the Rh sugar protein. Based on that, they're going to have both anti-A and anti-Rh antigens. So as you're working on our last two blood types here, use the information you can get out of the letter that's involved, as well as the positive or the negative, to give you an idea both of what I have on my red blood cells and what I have in my serum, in my antibodies. The one last thing I want to mention with this blood typing is in lab, when you worked on the blood typing lab, there was a discussion of anti-A and anti-B serum and how we can use that to figure out what kind of blood a patient has. So what we're doing with a blood typing test is we're taking artificial antibodies, things that didn't come from our patient, and we're adding them to our patient's blood to see what kind of antigens are on their red blood cell. So when we're thinking about how we do blood typing, maybe make a note for yourself that anti-A and anti-B, this is artificial. This is fake. We add this from the outside. When I add these different serums, that's going to allow me to see what my red blood cells have on top. So, for example, if my red blood cells have A sugar proteins on them, A antigens, when I add that anti-A serum to them, that serum's going to say, oh, I can attach to you. I see what I'm looking for. When that happens, that sample is going to clump. If I have B antigens on the surface of my red blood cells, and I add my serum that has antibodies against the B sugar protein, again, we're going to agglutinate, we're going to clump. The same thing works with Rh too, but here's something to keep in mind. If I'm testing a patient's blood and they don't have any antigens on their surface, I will not see any clumping, because when I put in antibodies for the A protein, not there. When I put in antibodies for the B protein, not there. So let's look at an example of different types of blood, how it would look when you perform this test. My first patient, when I added my serum that had antibodies against the A protein, notice how it's all clumpy in here. I know that this patient has A antigens on the surface of their cell. When I put in my serum that has antibodies against the B sugar protein, it also clumped. Based on the clumping that I see here, this tells me that my patient has both A antigens, because the antibodies found them, and B antigens, because the antibodies found them. This patient has type AB blood. In my next patient, I added antibodies against the A protein. My antibodies found the A protein. When I added antibodies against the B protein, it didn't find any. Notice how there's no clumping. Based on that, this patient only has those A antigens. This is type A blood. We go down here to type B. Notice that there's no clumping when I added the A antibodies, but there is clumping when I added the B antibodies. This patient is type B. And like we mentioned, type O blood has no antibodies on the surface of the cell, or antigens on the surface of the cell. So when I add antibodies that are looking for A proteins or looking for B proteins, I don't find anything. As you're studying this process of blood typing, please make sure that we know what these results mean. Anytime you see clumping, that means that whatever we're testing for is present. So check to see if we're using the antibodies for the B protein. Check to see if we're using the antibodies for the A protein. And I know that this particular picture doesn't show it, but we can do the same thing with the Rh factor. We add antibodies that are looking for the Rh factor. If they find it, they're going to clump things up. If they don't find it, we won't see clumping. So, know what antigens are present on the blood cells of each type, know what antibodies they would make, and be able to interpret a test like this based on the fact that we're adding an antibody to look for something, and if we find it, we're going to see this clumping.